Hi everybody, this is Dr. C from the Austin Gynecomastia Center, and my producer and I are working on this new video which we hope will be helpful. This is a patient that I have scheduled for gynecomastia. He came to me in the past and we talked about doing a video because he had actually asked me about doing some liposuction, not just of his chest but also of his abdominal area and the flanks. So I thought this would be a good opportunity to kind of talk a little bit about that. So in his particular case, you can see he's got fullness on both chests here. He's got firmness as well. He's got some glandular tissue beneath here, and he's really round. When I saw him in his t-shirt, it actually looked sort of breast-like, and that's what he hates. So he's going to have some gland removed as well as have some liposuction here. He also has a little bit of fullness up in zone 3 over here and a little bit on zone 2 as well. So I'm actually going to sculpt his whole upper chest. Okay, so that I have lots of videos about that. This is really about focusing in on the lower part of the abdomen. So let's talk about liposuction. The fact of the matter is most of the patients that I see for liposuction are not good candidates for liposuction. Most of the guys just need to lose some weight. Liposuction is not for weight loss. So a lot of us have extra fat and we're like, oh, I'm having my chest done, so let me have some liposuction. It really doesn't work that way. I'll almost uniformly tell you need to lose some weight. He actually lost additional weight than when I had last seen him, which is great. And the reason why I think he's a good candidate is because he's almost at his ideal weight and he still has a difficult area. So in other words, we're talking about an area that doesn't change when you get to the weight that you need to be. And that's an important point. So the great thing about his particular case is that I get to sculpt the abdominal area, the flanks, and the chest. So I'm really kind of bringing this all into a totally different proportion. And he's got great skin. So his skin is going to go back and do nice. If he has six-pack muscles underneath there, then they will show, because the reason why they don't is he's got such a layer of fat on the outside that it covers everything. All right, so let me digress a little bit into liposuction itself. I've done literally 5,000 cases. It's as reliable as the day is long. It's beautiful. As I've always written and encouraged everybody in terms of education, don't get too caught up with the various techniques. It's a lot of malarkey, a lot of baloney. Really concentrate on the surgeon who's doing the artwork. So whether you use a jackhammer or a laser or some fancy schmancy whatever, you're missing the point. You're just completely missing the point. Liposuction is how well somebody sculpts the fat beneath this skin layer, and there's different ways to do it, and there's really no proven efficacy of one way over another, whether it's melting it or magically dissolving it. Stuff that you'd put on the outside and not suction the fat out really doesn't work, so you know, you'll hardly see any changes with that. So in terms of liposuction, the other issue is intra-abdominal fat versus extra fat. Intra-abdominal fat is like a beer belly that's hard. That means that all the fat that you have is actually on the intestines on the inside, isn't on the outside. So you can't suction fat on the inside. That's not going to happen. So a beer belly is not a good candidate. Flex your muscles, make it tight. So you could see he's doing pretty good here. He doesn't have a lot. He's ideal. And we'll do people that are certainly bigger than him as well. But like I said, the most important point to be aware of is that most of the time you'll be told no. And so, and that's just me. I can guarantee you can go someplace else and they'll be happy to do it. But what you really got to be careful about is doing liposuction and then you gain weight. And now you have a weird situation because it goes to your face and your earlobes and everywhere else. So that's that whole fat traveling, and you don't want that to happen. So basically, the idea about liposuction, be close to your ideal weight or pretty close. Just have difficult areas. Understand that liposuction is not for weight loss. It's just not. So if you're overweight, suction is not the answer. Forget the magic little things you hear about the various techniques. Liposuction is liposuction. Concentrate on the surgeon and not on the technique. And then hopefully in this video we'll talk about and see his case, so I'll give you a better idea of what we do during that procedure. Thanks, and talk to you in a minute.
I originally came about Dr. Caridi through some online research, looking online and just like Googling male breasts and man boobs and things like that, and certain procedures or things you could take to get rid of them, because I'd been working out for months and months. focusing on the chest area, and it just never went away. I always had the roundness in my chest that I could never get rid of. So that's basically how I came about gynecomastia surgery, and through that I found Dr. Caridi online and saw a few of his videos, and that was very insightful and gave a lot of information, and decided that gynecomastia surgery was probably the best thing to get rid of this breast tissue problem. I think what caused my gynecomastia was when I was starting puberty, my nipples were very sensitive, and there was a small lump right under my nipple, and it was incredibly painful for about 2 years, and then eventually it went away. But what I think it did was like spawn some breast tissue to grow underneath my chest through puberty. So maybe I had some sort of hormonal imbalance that never got checked out. And as I gotten older, I gained a little bit of weight, not too much, like 10, 15 pounds. But ever since then, my chest has been my primary issue with my body. If I had the gynecomastia surgery, my problem areas like my stomach and my love handles would probably be magnified with the fact that the chest was no longer an issue. And I figured if I'm going to have gynecomastia surgery, I might as well ask and see about getting liposuction in my other problem areas too, and just get rid of everything all at once. I've been working out pretty consistently for over 15 years, but I've pretty much resigned myself to the fact that I would always have a gut unless I had liposuction, because no matter how many sit-ups I do, or even if my diet is really looked after, it's always going to be a problem area. There's just fat that I can't get rid of on my own. 6 months down the road after the surgery, I'm looking forward to just having less issues, waking up in the morning, picking the right shirt. I won't have to worry about covering up my problem areas because of my insecurity. And I'll just, generally, I think I'll feel a lot more confident and just free to do whatever, not worry about taking off my shirt in front of someone, or if I'm working out, not worrying about like if I'm bouncing around, if my boobs are going to be bouncing and stuff like that. It's just, hopefully it'll be a very subtle but very big difference in how I carry myself and my confidence level. What brought me to Dr. Caridi's office is through my online research. I feel like his website had a ton of information that I didn't find anywhere else. Also, the videos helped a lot in kind of getting an idea of his personality and the fact that he seems very passionate about solving this problem for a lot of men. So that, along with before and after photos and his years of doing this, made me feel really confident and made me want to see him specifically. If I had one thing to tell people that are experiencing this problem and thinking about having the gynecomastia surgery, I would say definitely just go with your gut. You've probably done a bunch of things to get rid of the issue. And if it's not working, it's definitely worth having a consultation and seeing what a physician suggests for you. And also to not pay attention to what other people say. So if someone tells you, oh, you don't need that, or you're fine, your chest is fine, if you have an issue with something, then you should go out and do it and solve that issue.
Hey guys, this is Dr. C from the Austin Gynecomastia Center. Step out of the shadows of gynecomastia. Call us, engage us. The Austin Gynecomastia Center in Austin, Texas, the #1 gynecomastia center anywhere. Thank you.